Well, hi folks, it is Friday, so it's time to get a weekly update with Dr. Janet Memark of Cobb and Douglas Public Health to see how Cobb County is doing in the COVID-19 pandemic. Now, you know the phrase, got some good news and I got some bad news. Well, in recent weeks, pretty much it's all been bad news, but this week we've got at least two bits of good news. Not great news, but it's good.
Right now we're about 12,700 cases over in Cobb County, so we are going up a bit, but we are cautiously optimistic that we are seeing a slowdown. So, it's hard to tell because the cases, because some of the testing delays, the cases will get backfilled and data gets backfilled. But from what we're hearing in the state, as well as our two counties, it seems like we have a slight slowing down. Now, I want to be very cautious about that, though, because we are experiencing a little bit of slowdown, but it is still very high numbers. And so when we look at those case rates, and you can go to the website, the Georgia Department of Public Health's website now, and see the 14-day case rates, which are probably one of the best numbers to be looking at. It'll tell you that we're still above 300 cases per 100,000 people in our district. Now remember, over 100 cases per 100,000 is considered high transmission. So we're still very high, but it is coming down. And so what that means is that we cannot be complacent. We can't stop the things that we're doing. If we want it to continue to go in the right direction, the things that we need to do is we've got to wear our masks, we got to keep our distance, and we got to wash our hands, but also, keeping away from large crowds. That seems to be a place where a lot of cases are being transmitted. So places like funerals and parties and things like that. So please continue to be vigilant because what we're doing is working. So let's keep on going with that.
All right, now from the bad news side of things, the death rate. If you look at the charts put out by Public Health, the death rate does seem to be climbing at alarming rates.
When we look at our deaths, we definitely have an increase, and we had a few more added today. And so officially we're up to about 313 deaths. We have had more deaths in the month of July than we did in June. And so we were coming down with that, and now we've gone back up. Now that is what's called a lagging indicator. So after we have our cases, then hospitalizations will follow that, and then deaths will follow that. And so if we're able to bring down the cases, we'll also be able to bring down the number of deaths. Now, this important about those deaths is that we do still have some in long-term care facilities, but they continue to be our people that are over 60 and definitely have chronic medical conditions. And so we're just consistently seeing the same thing, people with a lot of medical conditions that are succumbing to COVID-19.
Another interesting thing as we go through this pandemic, last week we told you that the age range of those testing positive for COVID was trending to be younger. Now those heading to the hospital are trending to be older.
So remember back in July when we had that big surge, we were talking about that we had younger folks that were being diagnosed and being hospitalized. Now the shift has gone back to our normal, or normal for COVID, of what we've been seeing. So definitely it's spread out a little bit more, but we are seeing more of our older people that are being hospitalized and continue, the ones that die continue to be older ones.
All right, let's do the bit about good news part 2 now, testing. Last time we talked with Dr. Memark, testing was an issue, not only getting a time to be tested, but the time it took for those test results to come back, and both those have improved dramatically.
So yesterday we were down to 2 to 3 days turnaround for testing, so that was spectacular. And we have a lot of availability right now, and that is to prepare us if we have another surge, or just to make sure that we have access for all of our citizens. So I have heard that people are saying that they're having a hard time getting appointments for testing, so I wanted to make sure we address that. On our website, cobbanddouglaspublichealth.org, you'll find all of our testing information. We have our sites that are more permanent, so the ones at Douglas Health Center and at Jim Miller Park, so they're there, but we will be doing pop-up testing, so you kind of have to go on the website to see where that moves around. So the core people are helping us with that, and so you can go and register for those appointments, but if you don't have internet or you don't have a car, you can walk up and register on site, and so those are a little bit more accessible for walk-up testing, so I wanted to make sure that everybody knew that. So they are not at capacity, so you can go over there and get a test. Other things for those we had talked about previously, they are the nasal swabs or self-administered. So you don't have to have the one all the way back into your, your brain bits. So if that is something that has been keeping you away from getting tested, please go to one of our other sites and you can do this self-swab, and it's a little less uncomfortable.
And when it comes to testing, we've had some pop-up sites show up in Cobb County, mostly down in the Austell area, run by a group called CORE. The actor Sean Penn put that organization together to try to make testing more available to certain people. That's been operating and doing fairly well.
So that is very, very important. Our fixed sites, obviously require oftentimes a car. We have had people walk up, but it's difficult to get there. And so there's some access issues as well. So if we have one site, we're not able to reach the rest of our county. We have some populations that we've been really trying to reach that are more vulnerable and need more access and education and things like that. So we have our Latinx community as well as our African American community. So you're going to see them this weekend. They'll be at on Saturday at Word of Faith Worship Cathedral from 10 to 4, and that is in Austell. They've been at the Epicenter a lot in South Cobb and in North Douglas, and so those are to do more outreach to some of our populations that are a little bit harder to reach, and we want to make sure that they get as good of access as everybody else in the county.
And another thing Dr. Memark wanted to point out is that we now have a better idea of the dangers that some folks with certain chronic conditions face when it comes to getting COVID.
As we continue to learn more about this disease, everybody knows that chronic medical conditions are the big ones that make you at risk for having complications from COVID-19. Those we know, like lung conditions and things like that. But I want to make sure that everybody knew that it actually touches a lot more of us. So people with hypertension and diabetes are the ones that also are at great risk, and people with obesity. So I want to make sure that everybody knew that, because we probably all know people that fall in this category, and when we review our mortality in the counties, there's a lot of people that have those diseases, and so you are at higher risk. I want to make sure that when you go out, you're cautious, that you are wearing your mask, keeping your distance from other people, and always washing your hands. And those are our big things that we got to continue to do as we move into flu season soon.
All right, so we've had two bits of good news in today's report, but Dr. Memark is worried that might convince some people to let their guard or their masks down.
So I always feel like I give you the doom and gloom on this interview, but things are looking a little better, but we got to keep going, because if we let down, it goes in the wrong direction, and we're doing a great job. And so I want to make sure I thank everybody, because it's a community effort. That's the only way to bring these things down, and it's the only way we're going to keep it down as we continue to work together. So thank you.